Hello everyone, good afternoon. My name is Courtney R. Holler with the OJJDP Tribal Youth Training and Technical Assistance Center. Thank you for joining us today for the Suicide Prevention Integrating Effective Processes Within a Tribal Youth Program webinar. I'll be presenting today along with a colleague of mine, Ms. Erin Thinelk, as well as our collaborating partners with the Suicide Prevention Resource Center. And we also have a guest from the Lower Brule Sioux Tribe Partnership for Success. We'll be sharing some of their experiences. And so we look forward to that and all the expertise of our guests today. And so with that, I'm going to turn it over to Nicholas Birdshead, who's going to take us through some housekeeping and technical instruction at this time. And then we'll move into our next sessions. Next. And thank you very much. So yes, as requested, if you could please type in your name and where you're from, and if you have any colleagues in the room with you, we would greatly appreciate that. At this time, as we do most times, we try to open in a good way. So I'm going to turn it over to my colleague, Miss Erin Thinelk, and she's going to lead us in our welcome this morning.
Thank you, Courtney and Nick. It's my honor to welcome everyone and open today's webinar with our special guests from the Suicide Prevention Resource Center and from the Lower Brule Sioux Tribe. We want to welcome all of you as our relatives and thank you so much for your energy and your time and contributions to today's important discussion for the health and well-being and healing of our tribal communities. In order to welcome you in a good way, we wanted to share a resource from the Indian Country Child Trauma Center, and this is In the Circle Way, Teachings of the Spirit. Know that you are sacred, know that you are honored, know that you are prayed for, know that others gave offerings in your behalf, know that you are not alone, know that you were known before you came to this place, know that you have choices, know that you have a name, know that many know your name, and know that when you reach, you also are reaching towards others. Next, we're going to go over, this is an overview for today's presentation. We'll start out with outlining and looking at the learning objectives for the presentation today. And then we'll have some introductions from our OJJDP Tribal Training and Technical Assistance Center, from which Courtney and I are part of. We will hear from our colleagues from the Suicide Prevention Resource Center, as well as a speaker from Lower Brule Sioux Tribe's Partnerships for Success program up in Lower Brule, South Dakota. Next on the agenda, the Suicide Prevention Resource Center will provide an overview exploring some effective prevention strategies for suicide prevention. Also, they're going to be sharing some opportunities to get involved with suicide prevention. And then we have our colleague from the Lower Brule Sioux Tribe. She's going to provide some case examples on how they have strategically planned suicide prevention in their community, what they've learned, some strengths and challenges, looking at all of the last couple of years and where they hope to head. Then we'll review the session and close with some questions. In today's learning objectives, we're really hoping by the end of this, you as the participants will gain an understanding of why weaving suicide prevention throughout existing initiatives really is the most effective way to approach suicide prevention at the community level. We also hope that you as participants will learn strategies and examples of engaging partnerships, leadership, and decision makers in comprehensive suicide prevention. Also, we hope you as participants will be able to learn more where to access information about evidence-based practices that have been effective in our tribal communities, as well as other best practices and funding for suicide prevention. Again, we're so happy that you are here with us today. Thank you so much. I'll go ahead and pass it over to Courtney.
Thank you very much, Erin. I appreciate that introduction and getting us started. So one thing that we like to do is to kind of break it up and So what we're going to do is we're going to pull over a poll, and we're going to ask that everybody take a moment here to help us get a gauge of where everyone is. And the question that is posed is, what is your level of knowledge regarding suicide prevention? And so you will just go ahead and select either no knowledge, some knowledge, or a lot of knowledge. And we'll take a few moments and allow everyone to respond. And it's great to see that we have everybody so far seems to have at least some level of knowledge regarding suicide prevention. And we also have, looks like a large number of folks join us today that have a lot of knowledge, and so that's really great. And so we hope that what is shared today is continues to grow and to benefit that knowledge that you already have. And we look forward to some robust conversation within the chat box and Q&A and some robust questions for our expert panel today. So again, we thank you for your time and thank you for participating in our poll. So it says 67%. Oh, it changed on me. Around 64% say that they have some knowledge, and around 35% of today's participants have a lot of knowledge. So again, that's great news. Okay, we're going to go back to our slides here. So I wanted to introduce the OJJDP Tribal Youth Training and Technical Assistance Center. For those that are not familiar, we are the National Training and Technical Assistance Center for the Office of Juvenile Justice and Delinquency Prevention. And we're hosted at the Indian Country Child Trauma Center, which is also hosted at the University of Oklahoma Health Sciences Center in Oklahoma City. This is our center email address as well as our center website. So if you haven't had a chance, please visit our website and see a lot of different resources that we have available for those working in the juvenile justice field. Now, what do we do at the OJJDP Tribal Youth Training and Technical Assistance Center? We support tribes that are seeking to prevent or control delinquency and improve tribal juvenile justice systems. We primarily provide training and technical assistance to 2 OJJDP-funded programs, and those programs are the Purpose Area 8, which is Tribal Healing to Wellness Courts, and Purpose Area 9, which are tribal youth programs. And the best way that I sort of explain them is that the Tribal Healing to Wellness Courts are helping the tribes develop their wellness courts so that they can work with the youth that are in the juvenile justice system and help them with their healing and keep them out of the criminal system. The tribal youth programs, we have a lot of tribal youth programs doing a lot of prevention work and deterring youth from entering into the justice system. And so we're very honored to be doing this work and supporting our tribes and our tribal communities. Some of the responsibilities that we have as the Tribal Youth Training and Technical Assistance Center. We not only support tribal grantees in their development of their strategic plans and other programming activities that they pursue, we also support tribal juvenile justice issues all across Indian country. So anybody working within justice issues within Indian country, we are available as a National TA Center to provide technical assistance and trainings. This suicide prevention webinar being an example of the kind of training that we can offer and we do offer. So again, we offer development of projects, culturally appropriate programming and evaluation, trauma-informed care principles, prevention and intervention approaches, and coordination of resources. Ultimately, we hope to reduce the number of youth and juvenile justice systems and reduce exposure to trauma. This is a snapshot of, or a screenshot of our website. So again, the URL is www.tribalyouthprogram.org, and you can go there and see what resources we have available. We have webinars, archived webinars. We try to link to other outside resources and things that are happening within juvenile justice and Indian country. So please feel free to check that out and also visit our calendar of events to see upcoming webinars. There's also a way to sign up for our newsletter as well. So at this time, I am going to transition to our friends, our colleagues with SPRC, the Suicide Prevention Resource Center. And so I'd like to turn it over to Ms. Amy Painter. She's the coordinator of tribal initiatives, and Ms. Kelly Berryhill, who is also a tribal prevention specialist. So at this time, Amy and Kelly, you're on.
I think Amy got disconnected, but just to introduce myself, my name is Kelly Berryhill, and I am an enrolled member of the Sac and Fox Nation of Oklahoma. And I'm joining this webinar from Lawrence, Kansas, and I recently joined SPRC as a tribal prevention specialist, and I am currently working with tribal grantees implementing suicide prevention programs in various settings. And I don't know if Amy can introduce herself. Okay. I think we're still having some technical issues with Amy's phone, but I can just go ahead and continue on until she gets her phone to work. But
I think that'd be great.
Okay. Amy is the coordinator of the tribal initiatives at SPRC. So moving on, this is our disclaimer, but the Suicide Prevention Resource Center at EDC is supported by a grant from the U.S. Department of Health and Human Services and the Substance Abuse and Mental Health Services Administration Center for Mental Health Services. The views and opinions and content expressed in this webinar do not necessarily reflect the views and opinions and policies of these organizations. Just going over a quick overview, the Suicide Prevention Resource Center, we will go over effective prevention strategies as well as reasons to visit the SPRC website. We will go over suicide prevention programs, and we will also highlight 2 reports specifically for juvenile justice systems settings. Just a quick overview of the Suicide Prevention Resource Center. You will hear us say SPRC a lot, but we have been funded since 2002 by SAMHSA, and kind of part of our role is to provide training and technical assistance for suicide prevention grantees and state leadership, unfunded state leadership. SPRC also provides secretariat support for the National Action Alliance for Suicide Prevention. And we also, through SPRC, offer the weekly Spark newsletter that provides the latest news and research. If you are interested in signing up for the weekly Spark, you can go to the SPRC website. Alongside the SPRC website, we have an online library of resources and programs that anyone can access, I believe free of charge. So that is also on the SPRC website. We also offer online learning tools, toolkits, fact sheets, guides, and more. And we will highlight some of those next. So do we know if Amy's line is working now, or should I just continue?
I think you need to go ahead and continue if you could, Kelly. That would be great.
Okay, sounds good. Okay,
thank you.
So going on to the effective prevention strategies, I'm just going to give a brief overview, but because suicide is such a complex issue, SPRC has highlighted that strategic planning and keys to success and a comprehensive approach can go into the effective suicide prevention. Looking at the comprehensive approach, you can see that they chose to kind of incorporate them as different puzzle pieces, and understanding that all of these all of these components are needed to provide that comprehensive approach in suicide prevention. For instance, reducing access to lethal means, we'll talk about that in some of the resources provided in the SPRC website. Responding to crisis, increasing help-seeking behaviors, and also care transitions and linkages is also a big part of what we'll be talking about today and providing the resources for you all. Another crucial part in the comprehensive and effective prevention strategies are the keys to success, and those are engaging people with lived experience. And when we talk about lived experience, we're talking about individuals who may have experienced suicidal ideation, have made suicide attempts, and also family members, involving them and engaging with them to incorporate strategies that work in prevention efforts. Also, looking at partnerships and collaboration, realizing that we will work better as a whole, and when we work towards a common goal, we can accomplish a lot more than individually. Looking at safe and effective messaging and reporting, a really crucial part of the keys to success include the cultural competent approaches, and understanding that communities, Native communities, understand their communities, and they understand what would work in their environment in the communities, and what necessarily the challenges that they face as well. Also looking at evidence-based practices. This just provides a strategic planning approach to suicide prevention and breaks it down in different steps. You can see that the first step is describing the problem and its context, choosing long-term goals, identifying key risk and protective factors, and you can see just the rest of the steps. But a big part of strategic planning is evaluating to make sure that the programs we are offering are being effective. Next, I'm going to shift focus and to give a kind of one of our first resources that we're going to highlight, and this is the settings page on the SPRC website. You can navigate to the American Indian and Alaska Native settings pages from SPRC's homepage by clicking, let's see if I can do this, by clicking the Effective Prevention tab at the top. And when you click that tab, there will be a drop-down menu, and on the very right-hand side, under Settings, is American Indian and Alaska Natives. This page is for individuals or organizations that serve in American Indian and Alaska Native settings, or who just want to learn more about suicide prevention in Native communities. This page gives a brief overview of why and how to take action in American Indian and Alaska Native communities. And on these pages, you will find specific information on understanding the scope of suicide in general, and see resources that incorporate not only cultural competency and resiliency, but also acknowledging the power of the community and determining and developing the most appropriate responses to suicide. This page is where you'll find all the Native-specific resources that come in a variety of different formats that include manuals, guidelines, fact sheets, and also we have a couple of community stories, to just name a few. But to find a complete list of resources, you'll scroll all the way down to the bottom of this main page and see all the resources that are specifically involving American Indian and Alaska Natives. I also wanted to mention that one of our goals is to continuously update these pages, and I would just encourage you all to visit the American Indian and Alaska Native settings pages for new changes and highlights to come.
Hello? Can you hear me?
Yes. Is that you, Amy?
Oh, yeah, it's me. I apologize for the technical difficulty. I just wanted to add one note. If you notice on the top ribbon of this, where it says Suicide Prevention Center, one of the very important resources that I forgot to include in the downloadable document. So if you look at the presentation for download, we have a top 10 _AIAN PDF, and that contains the links to all of the different resources that we'll be highlighting today. But one of the links that I forgot to include was the National Suicide Prevention Lifeline, and that number can be found at the top ribbon on the sprc.org website. They also have their own website, which is suicidepreventionlifeline.org, and the number is 1-800-273-8255. So I wanted to highlight that because it's not in my downloadable document, but I'm also going to put it into the chat for posterity. And I'm sorry for the technical difficulty. Thank you, Kelly, for taking care of the first part of my presentation, and I will let you continue with your next settings page.
Awesome, Amy. Thank you for highlighting that. The next settings that I wanted to highlight are the juvenile justice system settings. To access this particular settings, you would do a similar pathway to the American Indian and Alaska Native settings, but I wanted to highlight this guide to developing and revising suicide prevention protocols within juvenile justice facilities. You can access that on the Juvenile Justice Systems settings page. I also wanted to highlight recommendations that are on the Juvenile Justice Systems page that include suicide prevention training for all personnel in direct contact with youth, as well as screening for suicidal risk to occur on an ongoing basis, as well as adequate follow-up and referral to services. Similarly to the American Indian and Alaska Native settings page, the resources that are relevant to juvenile justice will be listed on the bottom, and they come in an array of formats as well. I'm going to pass on the talking to Amy, who will now discuss the state pages.
Great. Thank you, Kelly. So one of the resource tools that we use, grantees know about this resource, but it's available for public use on the website, and a lot of people that are not grantees don't know about it. So when speaking with people who are interested in suicide prevention, one of the things that I point them to is the state pages on the website. So if you look across the top and you select the organizations tab, you can click on the states, and it'll bring you to a listing of all of the state pages. Why would you want to visit here? Because it answers some questions about who, and you can answer some questions about what. So you can get contacts, you can find organizations, you can see a listing of grantees. There's information such as suicide prevention plans, what's going on in the latest news, and then tools are posted on the pages. So let's go ahead and look at a sample state page. So this is, if you were to click on the state of Oklahoma, scroll down in the first page and click on Oklahoma, this is what would come up. And so the state pages generally have a link to the state suicide prevention website, which you can find at the top. And if the state has a coalition that's working on suicide prevention, they usually have a link to their website. They also provide 2 contacts. So for Oklahoma, they have Shelby Rowe, who is the state coordinator. She is also a member of the Chickasaw Nation, which I thought was great that they have tribal representation within the higher state level. You can also find their state plan here, which is valid. So they implemented a statewide suicide prevention plan that's in effect through 2020. Under here, they have a listing of anybody who is currently funded under specific grants, which I'll talk about a little bit more later in the presentation. But these are individuals who have received some sort of funding to provide suicide prevention programming. Here is a list of common state programs that work in conjunction with suicide prevention. And so if there's a link to the website, you can click, it'll be a live link, and there's usually a phone number. And so I just wanted to dive down a little bit more. So say you're in Oklahoma and you recognize one of the communities is near you that received suicide funding. If you were to click on that link, you could get specific grant information. You would have the contact for the organization available, email, phone number. It would tell you what kind of grant type they have. This one is an example of a campus grant. It's currently active, and they were awarded in 2017, and they're located in Oklahoma. And then you can read a short description of the activities that they'll be engaged in for their suicide prevention efforts. All right, so I didn't see any questions in the Q&A pod, so we wanted to take a brief break to see if there are any questions about what we had presented to date. And so if there weren't any specific questions.
Hi, Amy. This is Courtney. While we're waiting
Okay.
on a few questions, I think, well, I did pose one in the Q&A, so when you get a chance, maybe you could look at that. But I also wanted to mention that it's great that you mentioned the state of Oklahoma. I know we have participants joining us today from all over the United States and tribal communities all over. However, in the state of, if we have any in the state of Oklahoma, you know, our center is located in Oklahoma City, Oklahoma, but we've also partnered and are collaborating with the state of Oklahoma in their suicide prevention efforts. And so, you know, you can contact and visit our website to learn more about those collaborations. And there's actually some really nice, cool trainings, avatar simulation trainings for gatekeepers that we have collaborated with the state on. And so we're happy to share information on those if anybody's interested in located in Oklahoma. So I just wanted to mention that.
Right, so I was just going to refer back to your question about the Suicide Prevention Lifeline. So the National Suicide Prevention Lifeline is a national network of local crisis centers, and they provide free and confidential emotional support to people that are in suicidal crisis or emotional distress, and that is available 24 hours a day, 7 days a week. So anybody can utilize that. You can have individuals call it. Some people who are maybe a support may call with the individual and stay on the line with them while they're trying to access services, but that is a free service for anybody to use. If you go onto their website, they have additional information, and they even have specific resources to Native Americans. So you can click on their Native Americans tab and find out more information about that. In addition to the National Lifeline, you would want to know in your state, because some states actually have state lines, if there's a line available and how you might be able to utilize that also.
And Amy, can you speak to, this is just from my limited knowledge, I believe the National Lifeline is always willing to partner with any tribes or communities that have additional referral resources that they would like added on their list?
I actually do not run that website, but I'm sure they do work with local crisis centers.
Right.
So I'm sure that they would be willing to do that. But they do partner with the state one. So for example, in Oklahoma, you have the National Lifeline, but you also have a state lifeline, and I'm trying to remember the name of it. But it would be on the state website. So that's one of the things. Look, if you go to the state prevention website, it usually will have state-specific information, like if there's an existing line. And I know in some states, like the tribes partner with the state lifeline, and then there are even some tribes that have their own lines.
Right.
It's kind of district by district.
Great. Thank you.
So if there aren't any other questions, did you want to go to the poll?
Yeah, let's go ahead and go to the poll. So Nick, we're going to ask him to pull over the poll. There it is. So again, to break it up and to see how well we were listening and paying attention, we've created a poll here and like everybody to participate. So which of these guiding principles are not one of the keys to success in suicide prevention? Is it evidence-based prevention, partnerships and collaboration, limited prevention approaches, or culturally competent approaches? Great. Looks like we're getting some response. And good. All right. It looks like things are slowing down here. So we have 21 respondents so far. 95% have said limited prevention approaches is not one of the keys to success in suicide prevention. And we're going to call you guys some winners because I believe that is the correct answer and the answer that we were looking for. So thank you very much. All right, I'm going to turn it back over to Kelly.
Awesome. Thank you, Courtney, for directing that poll. I wanted to highlight another great resource that the SPRC website has, and these would include the SPRC webinars that are under the Training and Events tab at the top of this page. But these webinars, they address a variety of different topics and settings within suicide prevention, and the screenshots that I have on the slide right now kind of just show an array of the varying topics that you can access through these webinars. But once you get into the webinars section, you can filter them by population, settings, also by other components such as planning and implementation methods as well as strategies. We believe that these webinars are a great resource to have to expand your knowledge on various topics related to suicide prevention. And the other great aspect of these webinars are that you can access these webinars at your leisure. So whenever you have any downtime, you can just go to the SPRC website and click on a webinar to just learn more. And also that these webinars list a point of contact for further questions regarding the webinar topic. So you have access to people from SPRC as well. Next, Amy will highlight another one of SPRC's great resources.
Hello, it's Amy again. So another free resource that SPRC offers is what we refer to as free self-paced online courses. Again, you can find this under the Training tab, Training and Events tab. So if you click on the Training Events tab and you go to the free self-paced online courses, you will find 4 courses that are currently available. And one is on preventing suicide in emergency department patients, strategic planning approach to suicide prevention, which you could look at and access and use if you did want to use some of the strategic prevention model, which is a component of the comprehensive approach, locating and understanding data for suicide prevention. But the one we really wanted to highlight was the Counseling on Access to Lethal Means, which we also call the CALM training. So all of these trainings are free. The individual must register and can receive a certificate of completion. If you click on the CALM, if you register and click on the CALM training, we have a picture of what the training would look like. So we wanted to highlight this one specifically because it's free, it's self-paced, it's online. Staff can schedule it in when they have downtime. They can make an appointment maybe with a group of staff persons to complete together. One of the recommendations, though, is that all juvenile justice staff who are in direct contact with youth involved in juvenile justice, that they have some sort of suicide prevention training. And so this is a free, very flexible form of training that you could use to meet that requirement within your own programs. So with that, I will turn it back over to Kelly.
Thanks, Amy. The next accessible resource on the SPRC page that we wanted to highlight are the virtual learning labs. To access these learning labs, you would go to the Training and Events tab at the top, and there are 2 different lab modules. One is for college campuses and the other is for states. Although the partnerships module is located in the states section, this learning lab is still useful information for any organization looking to create and sustain partnerships and collaborations.
The virtual learning labs consist of interactive modules. This specific partnerships module is designed to help state and community level partnerships build and improve more effective prevention efforts. Within this module, there contains information as well as in-depth activities, worksheets, and examples from other states. When you go into the partnerships module, you can either go right in and start completing each of the components, or you can go to individual topic areas, and the topic areas are listed on the left-hand side of the slide. Another resource within this virtual learning lab are the worksheets that are specifically associated with the partnerships module. These worksheets can be accessed without having to go through the module, but they can be completed as an added supplement as one moves through the steps of the partnerships module. There are 9 worksheets in total that can be downloaded, and some of the examples of the worksheets include identifying the right partners, addressing obstacles to accessing data, overcoming time and resource barriers, and formalizing partnerships. The worksheets can be useful in just organizing your thoughts on the partnership topics and can be used as a guide towards implementation and collaboration with partners. On that note, Amy will continue on discussing opportunities for partnership.
All right, so we wanted to fall in line with finding the right people to partner with. We wanted to highlight current funding that's available for suicide prevention that's occurring across Indian country. And so there are 2 primary funders of suicide prevention, and one is the Substance Abuse and Mental Health Services Administration, also referred to as SAMHSA, and the other one is the Indian Health Service. So SAMHSA provides 3 different types of funding for suicide prevention, and that is the Garrett Lee Smith, the Zero Suicide, and the Native Connections. And these are funding that tribes have are eligible to apply for. So Garrett Lee Smith actually provides 3 different types of funding. They provide funding to states, and then the example that I provided was college campuses, and then to tribes. Tribes and states are awarded 5-year grants to provide suicide prevention, whereas colleges or universities and tribal colleges can also receive funding. So if you look within your state, there may be a tribal college that's doing some suicide prevention that you could partner with. So again, referring back to the state pages, you can also see who has Garrett Lee Smith funding, what their plans are for their funding initiative. They also have a new award of Zero Suicide. So we have the very first cohort of Zero Suicide grantees awarded this past October 1st. And although that is not tribally specific, tribes can apply for it. And the first round of funding, they actually awarded 1 state, 1 health system, and 1 tribe. So those may also be tribally specific. And it's important to be able to know if your state is even involved, because they may be providing free training opportunities that you can access or your staff can access, and then partnering with tribal colleges or other colleges that may be in your region. Native Connections funding is also funded by SAMHSA, but those are not denoted on the SPRC website. Native Connections funding is specifically for tribes, so only tribes can receive Native Connections funding, but they will be doing suicide prevention and substance abuse prevention together through Native Connections funding. The Indian Health Service currently provides 2 different types of funding sources, which are the Methamphetamine and Suicide Prevention Initiative, which is also referred to as MSPI. And similar to Native Connections, they do joint suicide prevention and substance abuse prevention together. And then this year, they had their first Zero Suicide, and I believe they awarded 8 tribes funding to implement the Zero Suicide model. So these are all funding initiatives, suicide prevention, that are going on in Indian country. And so I'm going to get ready to turn it back over to Kelly, but if people could comment into the chat if you're aware of any of these funding sources in your community, like MSPI or Zero Suicide. Oh no, this is me, sorry. So then I wanted to highlight the Suicide Prevention Resource Center resources and programs. So you can click on the tab and come here and you can access resources that were developed by SPRC, or they may have been developed by other suicide prevention organizations and experts. We also have programs and practices. So we have programs that may have the designation of evidence of effectiveness, and you can see that if they have the icon, the check mark. And if you want to know more about evidence-based prevention, which we were highlighting, you can click on the link. But you can filter by the date if you only want to, so say you had looked at resources previously and you only want to see the new publications that have happened in the last year. You can filter by a date range. You can look at the resource and program type, like do you want articles? Are you looking for like a webinar? Like I'm not going to read a 90-day report, but I would be willing to sit down with a couple of my colleagues and watch a webinar during some downtime. You can look at specific populations, and then settings. Settings was where we had referred to the juvenile justice. So if you wanted to look at different types of resources related to juvenile justice, you could click on the Settings tab and click Juvenile Justice. If you wanted to look at publications related to American Indian or Alaska Native, you could click on the settings. So there's a wide range of ways to filter, and this will include a lot of tools, and we try to keep it up to date, so it should have the most up to date or being added to related to suicide prevention. And I will now move to Kelly. So she's going to highlight actually an example of a resource that you could find using the online library. And then she's also going to talk about our one of our partners, which is the National Action Alliance, and highlight a resource they have related to juvenile justice.
Okay, thanks, Amy. These are the last two resources that we wanted to highlight. But this first one is the Strengthening Our Future report. It specifically focuses on juvenile justice systems. This report expands upon the current understanding of child trauma in the context of juvenile justice, and it identifies key links between exposure to traumatic events as well as trauma-related disorders. This report itself identifies 9 implementation domains that are essential for trauma-informed juvenile justice diversion approaches. This report is pretty extensive, so there's a lot of information in this report. So I'm going to try to do my best to give a very brief overview of some of the important domains. Like I said, there's 9 of them, but I'm just going to briefly go over the 4 listed. In addition to the domains, the report goes into background into the issue and the scope, as well as strategies in reducing disparities, psychological trauma and its effects. It also highlights SAMHSA's concept of trauma and their guidance for a trauma-informed approach. The first domain I wanted to highlight is the leadership domain. This report stresses the importance of organizational leadership to make the design and implementation of trauma-informed care a priority. Because this does require a systems level change, it takes leaders from multiple departments and agencies to take collective ownership as well as responsibility in the challenges that face this type of change. I also wanted to highlight that in this leadership section there is guidance on memorandums of understanding, or MOUs, that cover that are often vital tools for establishing collaborative service agreements between and among agencies. These MOUs could cover areas like referral for clinical assessment, information sharing, and evaluation as well. The next domain involves engagement and involvement, and this advises that the youth voices are engaged in care and are also involved in systems planning. This offers guidance on fostering safe and supportive atmospheres, as well as how to engage traditional and non-traditional families in the healing and rehabilitation process. The next domain is the intervention continuum. This section emphasizes the need for a comprehensive continuum of care in order to avoid gaps in care, which we know can be detrimental to youth in crisis. Methods in providing this comprehensive approach include prevention, screening, assessment, treatment, and continuing supports. Also, this report goes, like I said, more in depth as far to what specific roles juvenile justice system staff play in each of the domains. But I also wanted to just highlight that in the intervention continuum. The last element of this report includes a section on workforce development. This type of workforce development is crucial in designing effective trauma-informed care systems and building skills that exist in the workforce through education and training programs. It was mentioned previously that the element of training is necessary when understanding suicide, and specifically for the purposes of this report, traumatic stress that could lead to suicidal ideation and suicide. It goes into what types of focuses trauma training for juvenile justice personnel should cover. I wanted to highlight that this report also goes into a brief overview of specific trainings as well as links to access these trainings. But one of the trainings is Think Trauma, which is specifically for training for staff in juvenile justice residential settings, as well as Target, which is a shortened version of T4, which assists in helping youth achieve personal control. And this specific training has been used in NYC probation and other locations in juvenile probation systems. The next and final report that I will be highlighting is from the National Action Alliance's Youth in Contact with the Juvenile Justice Systems Task Force. As you can see on the slide, there are 4 different areas that the task force identified and organized to contain findings and just different practical tools for juvenile justice and mental health administrators and staff. Under the public awareness and education section, you'll find 3 different types of fact sheets for different points of contact in juvenile justice systems. They just give a brief overview of statistics and information regarding juvenile suicide, as well as warning signs, protective factors, and how specific departments can prevent juvenile suicide. Under the suicide research area, there's a literature review that can be accessed to better understand the existing literature that surrounds suicidal ideation and the behavior among youth and juvenile justice systems. But from this main section, I wanted to highlight the screening and assessment for suicide prevention. As I mentioned earlier in the juvenile justice systems pages, one of the recommendations is to complete ongoing screenings. So this resource given by the task force offers tools and procedures for risk identification among juvenile justice youth. Under the suicide prevention and programming and training, there's another guide to developing and revising suicide prevention protocols. I mentioned another guide in the Juvenile Justice Systems page that has a very similar title, but this guide that the Action Alliance offers is a more comprehensive in nature. It breaks down different components such as training and communication by points of contact in the juvenile justice system. So these points of contact include referrals and arrests, detention centers, secure and non-secure facilities, and aftercare. Like I said, if you want more information on this, please access that from the National Action Alliance. Lastly, I just wanted to point out the under the Mental Health and Juvenile Justice Systems collaboration, there's a document that contains overarching priorities and strategies that can be implemented. These priorities involve collaboration to inform joint policy and budgeting decisions that are associated with suicide prevention for youth in juvenile justice. So each of these priorities are strategies that are listed, and they work to achieve collective suicide prevention goals across agencies. Also, at the end of this report, in the appendices, is an environmental scanning tool that can be helpful in identifying what is currently in place, strengths and weaknesses, as well as action steps, and identifying indicators and benchmarks to achieving these priorities. That's kind of a quick review of the last 2 reports that can be accessed through SPRC, but I hope that all these resources will be of assistance to you all, and again, I encourage you to visit the website and explore these resources in depth because there is a lot of information in them. Also, I just wanted to thank Courtney and Erin for allowing us to share these resources, and Amy and I will turn it over to questions.
So I had asked if people had questions, if they would put them in the Q&A pod, and I didn't see any. But I apologize again for the technical assistance issues that we had at the beginning. But I also wanted to reiterate what Kelly said. I wanted to thank Courtney for inviting us to share information and resources on this very important event. And I really wanted to give a shout out and a thanks to the OJJDP Tribal Training Technical Assistance Center staff for all of their assistance with tech and content development. They really made it easy for us to join this event and try to share some resources. So if there aren't any questions, we can move to the poll.
Okay, thank you, Amy. This is Erin. I'll go ahead and take over from here. Before we move on to our next poll that we would like you to participate in, I just want to thank you as well, both Amy and Kelly. You offered a plethora of resources, fact sheets, guides, support for strategic planning, you know, ways to engage key stakeholders, ways to fund and build capacity within the community for, you know, to build a larger safety net, so that that our youth and our families aren't, you know, falling through the cracks, and to ensure better outcomes. And I know that it's a lot of information, but you did a really great job of pulling out some of the key places and resources and presenting that. So thank you so much. Okay, so I'm going to ask the participants now, and it looks like a lot of you have already replied. Is there an existing suicide prevention program that you are currently partnered with? It looks like people are still replying, but the majority overall are saying yes, there is an existing suicide prevention program that you're partnering with. And there are some people that have responded, about 33% no. So for those that responded yes to the question, I'm actually going to ask an additional question and direct you to the Q&A box in the right-hand corner, bottom right-hand corner. And I'm going to ask those of you who said yes to please provide the program or programs that you are currently partnering with. So if you could go ahead and respond, those that responded yes to the question, if you could share who you're partnering with the suicide prevention programming in your community. It'd be good to hear from you all on who are your partners and who's collaborating with you. Great, thanks Christopher. I hope you're having a good day today. It looks like you guys are partnering with, and I know that you're a tribal youth program through OJJDP, and you are partnering with the Native Connections Grant program. That's great. Courtney, or I'm not able to see some of the rest of the answers in the question and answer. So are you able to scroll down on your side?
I am. We have Kristen Wilson. I'm familiar with her name, and she's an OJJDP grant. I believe they're a new grant, but let me think here. I believe they may be partnering with some suicide prevention initiatives within their community.
Looks
Okay,
like Marlene, thanks for she put it in the chat. For some reason I wasn't able to see it in the Q&A. So it looks like Native Connections for Katie, and Zero Suicide is in the area with Marlene. Christina, you also have Native Connections programming as well. Thank you for
April, looks like you have the Garrett Lee Smith, MSPI, and Zero Suicide in your community. So a lot of the funding sources that Kelly and Amy highlighted earlier are definitely being implemented and are active in some of our communities right now. Wonderful. Well, thank you so much for participating in this poll and giving some feedback in the chat.
Thank you, thank you, thank you.
Okay, so now we're going to go ahead and move on to our next portion of the webinar. And this is, we feel it's very important to hear from our tribal communities who are on the ground working and, you know, doing strategic planning with their suicide prevention. And we have a guest from the Lower Brule Sioux Tribe, Tanya Durdall. She graduated from the South Dakota State University and has a Bachelor's of Human Development, Child and Family Studies. She is a licensed alcohol and drug counselor and certified prevention specialist. She has been working with the Lower Brule Sioux Tribe for a number of years, and she has a very strong commitment to the children and families of Lower Brule. She works hard to promote life, reduce adverse childhood experiences, and help youth find joy in today and hope in the future. It's my great pleasure to introduce and welcome Tanya Durdall, and she's going to share a little bit about their Helping Each Other as Relatives Partnership for Success program.
Thank you, Erin. I appreciate you introducing me. I'm glad to be here today. As you stated, I've worked for a number of years for the Lower Brule Sioux Tribe, first with Boys and Girls Club here at Lower Brule, and then with the Partnership for Success program. Lower Brule Sioux Tribe is located right along the banks of the Missouri River in central part of the state. We have approximately 1,664 tribal members who reside on our reservation, but our overall membership is 3,410. So many of our people do reside off the reservation. Our median age is 22.5 years of age, with half of our members are under the age of 19 years old. So we have a very young tribe. Our number one goal through Partnership for Success was to reduce underage drinking by using a data-driven decision-making process and implementing evidence-based prevention programming. Our second goal was to enhance and sustain a system capacity to implement evidence-based programming to reduce underage drinking. Youth ages 12 to 20 are our primary focus. Supporting planning and development. We support the planning and development of a system of care approach as our tribe works towards that. We have used a variety of assessment tools. We believe in a community strength system. We build needs, readiness, and service system assessment. A comprehensive need and service systems assessment was conducted in partnership with the Lower Brule Sioux tribal community using a community-based and participatory approach. A wide range of people provided input into the assessment process, including our elders, parents, youth, community members, agencies, organizations, and administration. Some of the other methods of assessment we utilized were archival data collection, primary data collection, secondary analysis of existing local data, key informant interviews. The top 5 behavioral services which we found would benefit respondents and or the tribal community was number 1, suicide prevention, number 2, alcohol and drug education, number 3, family counseling, number 4, aftercare recovery and wellness programming, and number 5, prevention programming and individual counseling. Some of the interventions that we have begun to successfully implement in Lower Brule are the Natural Helpers Program amongst our youth in that age 12 to 18, American Indian Life Skills, which we have adapted to be Lakota Life Skills, We Are All Relatives, which is a culturally adapted version of Character Counts, the Boys and Girls Club, and then Cognito's Friend to Friend and At Risk for high school educators. We also offer school-based individual counseling with a mental health professional and school-based group counseling with a mental health professional or prevention specialist. Crisis response training and cultural-based gatherings are also part of our programming. We do an annual health assessment in our schools and during our Family Unity Day that happens every year, where Family Unity Day is where many of our tribal members, over 400 plus, will gather and we do our main survey there. We also implement the Hope Health Index in connection with our Lakota Life Skills, the Cultural Connectedness Scale, also in conjunction with our Lakota Life Skills, an annual health survey, and a process evaluation by evaluators. Some of our successes that we have had here in Laurel Borough are culturally appropriate prevention programs have been implemented. We have working partnerships with other tribal programs, such as our health program, the court, and circles of care. We give youth voice through Natural Helpers program. Through our Natural Helpers, the youth are finding a voice not only to be there for other youth their age, but have begun to speak out and speak with our council members as well about their needs and their peers' needs. We have crisis-trained community members. We brought in Dr. Mason, a well-known expert in crisis, and she trained over 24 of our community members in kind of a grassroots movement that has helped us address our crisis without the need of extra professionals, as we have found that to be one of our barriers, as you'll see next. Professionals and community members are comfortable with status quo. We all know change can be painful, both with professionals and with community members. There is a definite lack of access to mental health professionals and trained addiction counselors in our community. As I stated before, we really looked at implementing that crisis training for our local members, because we found that we have a hard time finding those mental health professionals, and when we do, they are booked up immediately. So we found that empowering our local community members has been a huge benefit. And then the finances, of course, being able to afford mental health and alcohol and drug addiction counselors can be quite costly. So we're finding ways that are free or inexpensive to meet our community's needs. Again, through the Cognito, the Gatekeepers training, and the Friend to Friend, that is a program that we're able to utilize for free that has had very positive results for us without adding another burden of having to figure out how to finance it. Some lessons that we've learned that communication is very key, not only with other tribal programs, but also with our tribal council. We've learned to involve our tribal council in decision making. We've gone to them to talk to them about our crisis hotline. We have gone to them to discuss with them our bringing the youth to meet with them. We continue to speak with them on an almost monthly basis. They sign resolutions. Of any grants that we may go after, or any partnerships. And we also provide a number of trainings. Some trainings we have provided already in our community is the Natural Helpers training, youth mental health training, crisis intervention training, suicide in relation to addiction training, and ones that are coming up for us are the means reduction training and adult mental health first aid training. Okay.
Thank you, Tanya, so much for presenting what you guys have been doing with your suicide prevention in up there in Lower Brule. So there was a question in the chat if somebody could explain a little bit about if we could go back and we're talking about the interventions that you guys had been implementing over these last couple of years, if there's a little bit more that you could share with a few of the programs, one being the Natural Helpers Program.
Sure.
And yeah, if you could start there. And I think that's really a good place to start, especially since, like you said, more than half of the population are about 20 years and younger.
Sure. We partnered with the state of South Dakota Prevention Resource, and they brought in training for our youth, again, that ages 12 to 18, and they provided natural helper training. We identified youth through a survey that were seen as leaders not by staff or by adults, but by their peers. And within each group and age group, we took those identified leaders that wanted to participate and train them in a 2-day, 1 evening, 1 long day, 8-hour day process to be natural helpers. We've provided them with ongoing support weekly during their lunch hour, and then once a month for an hour during their study hall. And they then can answer questions for other youth, provide support for other youth, refer other youth that may be at risk for suicide. One of the things that we're working on right now for those peer helpers is they identified that they wanted ongoing care and support more consistently than we've been able to offer. So we've actually partnered with our helpline, suicide support line that was being talked about earlier, and we are going to purchase a text line from them that is specific to our high school, and they will have that 24/7 support from trained professionals. That is one of our interventions that is trying to be emulated within our adult population. I know there's interest right now with our behavioral health and emulating that within the adults. So the other main interventions that we have is the Native American life skills. We implement that 12 classes throughout the year. We have 3 staff that go in, 1 mental health professional, 1 cultural professional, and 1 Boys and Girls Club staff for continuation when they go to the club, and they provide that program. We review it and assess it every year and make changes as needed, and this will be our 2nd year that we've implemented that program. The Cognito programs, we have implemented both the Gatekeeper and the Friend to Friend within our high school. We've had amazing feedback from the teachers in particular on the impact it has had in their teaching. One individual in particular with the Gatekeeper program stated that it completely changed the way that he did his teaching, the way he interacted with the students, and he has chosen to stay, had a really rough first year here in Laura Brule with his students and interactions, and after taking that program has chosen to stay and currently has a fellowship working with Laura Brule, has made quite a few changes within our school system. So we've had some great success with that program in particular. So those are some of our key interventions that we are doing right now.
Thanks so much, Tanya. It sounds like you guys are doing a lot of great work up there. I want to invite everyone who has any questions for Tanya to go ahead and type those in the chat, and we'll go ahead afterwards when they pop up and pose those for Tanya. So if you could please ask any questions down in the chat box, and Courtney, if you could help me facilitate those a little bit while we're waiting for some questions to pop up. Tanya, would you be able to talk a little bit about how you leverage resources with stakeholders?
Sure. One of the ways we leverage resources with stakeholders is that we utilize volunteers within our community for many of our activities. We have a parent group that we do a lot of our alternative activities with, that they provide care and food and those types of entities. We've also worked with our behavioral health program. Through Partnership for Success, we're unable to provide food for meetings, and they have worked with us and are able to do that through some of their programming. We also have made the Boys and Girls Club one of our programs. Therefore, we've leveraged their dollars, their staff, and their resources in helping with the program as well. We work with the school. They provided location, staff as well to be in on our programming. So partnering has been a huge issue for us that has been very successful. Because if we are unable to staff something completely, we often are able to use our parents, our Boys and Girls Club staff, and community volunteers in order to do that.
That sounds really amazing that you have that grassroots level of support in the community. And could you tell me a little bit, are those same grassroots community members involved with the crisis training?
Yes, they are. Actually, the crisis training, most of the United for Youth staff, or volunteers, have been involved in the crisis training and have been involved in the peer helpers training and natural helpers training, and have been involved as well in the youth mental health training. All of the Boys and Girls Club staff have been involved in all of that training, and many of our courthouse staff have been involved in the crisis training, and some have been involved in the youth mental health training as well. So we try, when we bring trainings into the community, we try to recruit professionals, not professionals, and then have all staff that we have connection with to be in on those trainings. For example, I oversee the Boys and Girls Club as well, so my staff are required to go through those trainings because I think it's important that we as a community move together and move from the same place towards preventing high-risk behaviors. So they all attend that we can get there.
Mm-hmm. That sounds like a really great approach. And what I really like that I'm hearing you talk about is how active and important the youth voice is in being part of the intervention that's supposed to be empowering and for their health and well-being. So I'm really excited to hear about that with the Natural Helper Program and with youth involvement in annual trainings to help with capacity building. We know youth at this age, they do listen to parents, they do listen to teachers, but they're most likely communicating and connecting daily with their peers. So being able to have the peers have that gatekeeper training to recognize psychological distress, emotional distress, and connecting them to the resources that can assist them is really powerful. And I'm really happy to hear that that's happening in the community.
Yeah, our youth are finding their voice. They're beginning to speak up. We've had GONAs that we provided that have given them an opportunity to also do some media work, which we hope that program in conjunction with Circles of Care, one of our partners, will be rolled out in our community soon in conjunction with our Family Unity Day, where the kids express how important they feel it is for us to all work together as one voice, one group. So
that's great.
Looking forward to that.
Yeah, that's great. I just wanted to jump on and build off of that and build off of what Erin said. Yeah, it just sounds like you have some really wonderful approaches in engaging youth and engaging the community in what we say meaningful ways. And so, in a way, you're not necessarily planning program activities for the youth, but you're planning and developing an initiative with the youth. And so it really sounds like there's a lot of ownership of these skills and this capacity and building and truly building capacity with the community. So thank you for your work. There was a question that was along those same lines, and they were asking a little bit more information about the friend-to-friend simulation. I believe that's the Cognito Avatar simulation. And I can tell the description and objectives of it, but if you in your own words could share a little bit about the friend-to-friend simulation and how it's been effective with the young people in your community, that would be wonderful.
Okay. The friend-to-friend simulation is an avatar simulation, computer-based, that youth take and do at their own pace, answering the questions and then taking tests, and they got to be right to get all the way through the program, so they learn things correctly as they go through it and how to refer and help their youth. We found it to be, liked by our students, utilized by our students, and to have affected change amongst our students. So we've had a positive impact utilizing that program, as well as the Gatekeeper program, as I spoke of. So what we like about it is that they learn things the right way, that they use an avatar that represents and looks like them, that it uses their language, the youth language, and that they can move at their own, fairly much at their own pace. So.
And that training is free for those that are on the line. I just wanted to reiterate that that is a free training through our Tribal Youth TTA Center, and we are here to assist you with how to access and with implementation guides and other resources to help you plan on how to implement the trainings within your community. So thank you, Tanya, for sharing some about that. I have another question. It looks like, do you have a community advisory committee or board? And if you do, who's a part of that, and what has been their role?
Okay, our community advisory board is in conjunction with Circles of Care. We share an advisory board. We are a small reservation with, so it has been to our benefit to share an advisory board. What we do is we review our programming with them. We share with them what we're going to be doing, what the research is on it, and then we ask for their approval and guidance in it. And it is a combination of individuals on our advisory board, elders, professionals, community members, cultural experts. So they help us really shape our programming around what the community needs and wants. We take into light their opinions in all that we do. So one of the things that we found successful is that partnership with Circles of Care on the advisory board. So much so, in fact, that this coming week we will actually be combining with the community wellness program, and they will become a part of our advisory board as well, moving towards that society care, and again, utilizing our human resources to the best of our ability in such a small community, looking again to have more voices and to move together in a good way. So everybody's moving and getting the same messages and working towards the same outcomes in our community.
Okay, so what I'm hearing is that instead of having, several different community advisory boards or committees, people are, moving into being more of one advisory committee, and being the active advisory committee for many different initiatives within the community, so that people are on the same page.
Yes, that is correct.
Okay, that's a really smart strategy.
Thank you.
I have a quick question. Are there any youth that ever come and are a part of the advisory committee?
We are working hard to get youth there on a routine basis. We have had them attend some of our evening meetings, and we are hoping that with it moving to we're now moving it to an afternoon at a time that works well for all that are involved and all coalitions that are coming together, that we will be able to work with our school and have youth regularly attend it monthly. We have a prominent educator that will be on the board as we combine, and we feel that he'll fulfill the role of bringing those youth with him. One of the reasons we wanted to combine is to have a more consistent youth voice.
Okay, so that's great. So you feel like it's really been a great approach to offering insight and balance to your outreach, is having that sounding board to pull from.
Thank you.
All right. Let's see if there's any other questions in the chat. It looks like we could probably take about one other question. So it looks like someone was asking about cultural, the cultural adaptations or effective cultural programs. And I know that you before had talked about American Indian life skills and working on making that culturally appropriate to being Lakota life skills, and then also with the We Are All Relatives. So I'm just kind of wondering if you could share a little bit about that and if there's any other cultural programming that you found to be effective.
The We Are All Relatives is character counts adapted for Native American communities. And actually the person that presents that program within our schools is my cultural expert. And he is an enrolled member of the Lower Bro Sioux tribe and has great knowledge in the culture and in the community here. So he adapts that appropriately for the students that he is sharing it with. And then our Lakota Life Skills is actually a program that is provided within our high school, within our Lakota language program, and both my staff and a boys and girls staff along with a Lakota teacher are involved in that presentation, so the language becomes a big part of it, making sure that it is culturally appropriate for this community as opposed to the Zuni community that it was originally written for. Mark and Jessica, two of the staff, one being the mental health and one being the culture, go over it ahead of time and make sure that they've made those adaptations before they present it. And Mark actually just brought me the beginning of the We Are All Relatives program, and it specifically states in there that the culture of the American Indian plays a central role in the lives of the students, so they make sure that this program is adapted to those students, appropriate for those students, and takes that into consideration. So, and they specifically base their programming on the Lakota values and fit it together with the 6 pillars that were originally written for character counts. So it's been specifically adapted for our community and for the Lakota people.
Great. Thank you so much for sharing how it is very important that there are interventions out there, but then also to, run it by your community advisory committee and other community members to make sure that it's a good fit for, your own community.
Right. Thank you.
Did you have any other final things that you wanted to say, Tanya? Otherwise, we will go ahead and begin wrapping up and move towards closing out today's webinar. I want to thank you again so much for participating and sharing what's going on in Lower Brule.
I would just like to thank you for inviting me to present here today and to be a part of this, and I appreciate your time and letting us join in something so important. Thank you very much.
Thank you, Tanya. There's a lot of thank yous, but it's very much honored and very much appropriate. We have another poll that we're going to bring in at this time, and it's going to be our last poll before we exit for the day. And in this last poll is simply, did you gain new knowledge from today's webinar? Yes, I learned knowledge about suicide prevention resources and approaches. No, I did not learn any new knowledge. And we are off to a start here in answering this poll. So again, we appreciate your participation, as this helps provide us with a baseline knowledge so that we can just continue to grow and develop from here and provide training and technical assistance and resources that is a benefit to Indian country. And of course, we thank all of the presenters, the experts, the subject matter experts that joined us today, our collaborators from SPRC, the Suicide Prevention Resource Center. I know they come with a plethora of resources, and also work with our tribal communities throughout the nation, and have a wonderful experience. And we know that our tribes are being very innovative and creative in addressing a lot of these issues, and that are related. We talk about suicide prevention, we talk about substance abuse, we talk about juvenile justice, all these issues, but we also know that these issues are also very, very much related. And so it looks, when we have opportunities like this where we can come together and share our resources, it's always a great thing. Thank you, Nick. If you can take away the poll, I wanted to show our last closing slide. Thank you, everyone, for participating. Again, Tanya, we love to hear those experiences, and we love to hear the stories of what's happening in the communities. And I think that's where the real learning happens. We develop tools and resources, but when we get to reflect on what the changes and the amazing things that's happening in the communities, I think that's when we really learn a lot and we take it away. So thank you for sharing your stories, and for all of you for listening. Please continue to, we ask also for your feedback in our final survey. We will provide the link here at the bottom. And yeah, there it is. So your bottom left hand, it says webinar survey. Just highlight that and hit browse to, and it should open it up in a whole nother room for you. And just a reminder that this webinar has been recorded and will be made available and archived on our website. For everybody that has registered for the webinar, you will receive an email when that happens, when we have archived the webinar. So at this time, we want to wish all of you a wonderful day and a wonderful week, and thank you for your good works. Thank you for your patience. Thank you for your presence and your time and your energy. We just hope all good blessings for you and the endeavors that you have in front of you, and we just thank you for your time. Until next time, we'll see you.